let's go ahead and get started. Again, my name is Betsy King, and I'm the clinical educator for Hospice Corporation. And I am so delighted today to bring this great educational opportunity to you from one of the Opus Peace ambassadors, Stephanie Turner. Stephanie's been a registered nurse for the past 25 years. Most of her career, she's worked in a variety of critical care settings, but she also spent many years as a traveling nurse, visiting Miami, Las Vegas, and New York City. Today, she's found her niche in hospice as an after-hours nurse for Kansas City Hospice and Palliative Care. Stephanie also prides herself in being involved in her community outside of work as a volunteer for Lakeland Community Church, City Union Mission, and her children's school. Stephanie has a passion for caring for those who are hurting. 4 years ago, while sitting in an audience listening to a presentation given by Deborah Grassman on how to care for our veteran population, she heard the word soul injury. Stephanie began to realize that the information Deborah was sharing on soul injury not only helped veterans die healed, but it could also help people live healed. Since that time, she's been a part of Opus Peace, which is a grassroots organization that was started by 5 VA nurses who cared for more than 10,000 dying veterans that helps people live and die with peace. She recognizes that our world is full also not only traumatic events, but also insidious events that change our lives, sometimes leaving us with scars that can show up as pain, fear, anger, helplessness, and resentment. Stephanie's mission is to help others live with peace. Stephanie speaks on soul injury restoration, the suicide talk you're going to be hearing today, forgiveness and play, and the me brain. She has been on the circuit with Deborah Grassman at many venues. She comes to us today as a survivor of suicide, a survivor of trauma, a survivor of abuse. She comes to us as a survivor and wants to share how she today lives in peace and helps others live in peace. Thank you so much for sharing your time and expertise with us today, Stephanie. And with that, I will turn the presentation over to you.
Thank you, Betsy. Thank you. I just want to say thank you all for coming today or being a part of this webinar and letting me share my passion with you. My passion with soul injury and soul injury restoration, and with suicide, its healing and prevention. I'd like for everybody to get relaxed in their seat a bit, take a deep breath, and when you feel comfortable, I'd like for you to close your eyes. I want you to consider what image comes to your mind when I say the words soul injury. Now open your eyes, and many of you are in a room of people. Why don't you shout out what image came to your mind, what you reflected on, or what was impressed upon you? And if you're at home or by yourself, you can also say it out loud, or at least continue to think what was impressed upon you when I said those words. The fact is, I believe you already have a good idea what the definition is before I even give it to you. I'd like for you to consider the following questions. What barriers have you acquired that are keeping you from becoming your real self? Do you know how to develop a good relationship with that part of self that holds your emotional pain and distress? How could an understanding of soul injury help us better understand suicide, its healing and prevention? I hope I'm able to answer these questions over the next 60 minutes for you, and many more that you might be having. Let's first start out with a little historical background how soul injury was started. There's a small group of VA hospice nurses, 5 VA hospice nurses that took care of over 10,000 dying veterans. And what these nurses saw firsthand surfaced unbidden on combat veteran deathbeds. Some of these symptoms that they witnessed could not be explained in the DSM manuals. It didn't fit under PTSD, moral injury, or chronic stress intervention. And it took many years for these nurses to articulate what they were seeing. Soul injuries. Now, it may seem like an odd phenomenon that soul injury would be surfacing out of the hospice field, but many of you out there do work in hospice, and you know that the dying have something to teach us, don't you? Because the day before a person receives a terminal diagnosis, how do they act? They take life for granted, don't they? And the day after, there is a huge perspective shift that changes when you receive a terminal diagnosis, right? You begin to be acutely aware life matters. You matter. I matter. That is the gift that death brings. And when people are getting ready to meet their maker, so to speak, the unburdening of the soul emerges. The unvarnished truth will emerge. These veterans during this time began to reveal penetrating wounds to these nurses that were often described as a hole in their heart, a sense of emptiness and a lack of meaning and purpose in their life. These nurses learned from these veterans about unmourned loss, unforgiven guilt, shame, and feelings of helplessness, diminished self-compassion. And they would often tell these nurses that they had felt trapped in these wounds for years. Soul injury is about these privileged nurses seeing a change in perspective. When they witnessed these wounds with these veterans, they learned how to help them grieve their losses, heal their pain, forgive others, and forgive themselves, acknowledge helplessness, and increase self-compassion. And when they would do that, these nurses saw a liberating and lifting shift with these veterans. And they would often hear these veterans say, "Why did I have to be dying to learn how to live like this? Why couldn't I have learned to do this years ago?" That was the impetus for those 5 VA hospice nurses to leave the VA and take the message of soul injury out into the world. They recognized that not only did they have the tools to help others die with peace, they had tools to help others live with more peace. Now, after I've said that, I want you to consider the following questions. Could unmourned loss be a contributing factor of suicide or attempted suicide more than we've previously realized? Could unforgiven guilt and shame be covering up a sense of helplessness in both those who have attempted suicide or completed suicide, as well as for their families? How is our fear, feeling emotional pain, combined with the overuse of numbing agents to try to not feel the pain, contributing to emptiness, despair, and loss of meaning and purpose in life? Could a conversation about soul injury open a dialogue that might help people reckon with these wounds before they become acts of desperation? I believe the answers to these questions is yes, and I'm going to tell you why. Let's start out with what is soul. You know, many say that soul can't be defined. Webster says it is the vital or essential part of ourself. It is the essence of our being, beyond our body, beyond our mind. Some may call it our true north, or that compass that guides us through life. We also consider it as being a sense of self, our beingness, who we were meant to be. We use soul in everyday language without religious connotations. You've probably heard it in, "That's my soulmate," or "I like soul food," "deep in my soul," or "I've lost my soul." But I'm here to tell you that Opus Peace has no agenda about soul, what it is or what it is not. We only want you to be aware of soul injury. So let's define soul injury. It is a penetrating wound that separates one from their real self, affecting one's sense of being, corrupting how they perceive themselves. It is an aching wound perpetuated by unmourned loss, unforgiven guilt, shame, and diminished self-compassion. And it is a long-lasting response to a person, a situation, or ourselves that causes one to feel personally defective, inadequate, and unworthy. This was me. When I first heard this definition, I was acutely aware that this had described my life in a way that I had never heard it before. There is therapeutic value in just using that term. It gives people hope. You no longer feel alone, and it brings up a conversation. Let me give you an example of how the therapeutic value of soul injury can be heard. So a woman's daughter had died suddenly. Months later, the woman told her friend, "My soul is dead." The friend said, "Why do you say your soul has died?" The woman said, "Because my soul is who I am." I want you to listen to what her friend said. "Your soul is not dead. You are just so injured that you can't reach it right now." Her friend was intuitively aware that it wasn't her soul that had died. It was her grief that kept her from accessing her soul. That is a soul injury. When this woman came to an Opus Peace presentation and she heard the word soul injury, she went up and said, "I'm so excited to find out that it has a name, and that gives me hope." Hope is what I want to give to you today, because I know many of us recognize either within ourselves or within others a gaping hole that we have in our society. It's filled with fear, strife, hatred, violence, despair, depression, suicide, and more. Soul injury restoration tools can help heal those gaping wounds. We need to talk about the elephant that's in the middle of the room. Let me share with you how soul injury is a spectrum of wounds. Acute and chronic spectrums. Now, acute we all get because after a traumatic event happens, boom, our life changes, we're not the same, things are different. It's easily recognized. But chronic, however, I feel is probably the most dangerous because it's ongoing, it's relentless, it happens over time, and it covertly sabotages our lives and our brains before we even recognize it. I do believe this is the most dangerous wound because it becomes harmful before we even know it's there. Now, we also call this an insidious soul injury. So two ends of the spectrum, different rates, different routes, same endpoint. What keeps soul injuries embodied? Unmourned loss, unforgiven guilt, shame, and diminished self-compassion. These are a few things that we know keep soul injuries alive. And today, these will be my focus. Now, unmourned loss, it looks different than just death. Unmourned loss can be like loss of respect, loss of a relationship, maybe loss of feeling connected, and so on. Unforgiven guilt might look like irrational guilt, feeling guilt, being shamed, maybe the inability to feel a sense of helplessness. And diminished self-compassion is the inability to be compassionate to that deeper layer of ourselves. Now, this is a good place for me to teach you about one of our soul injury restoration tools. It's called the anchoring heart technique. You may see me use the anchoring heart technique during this presentation, and there may be something that triggers you during it and you may be sensitive to, and I'd like for you to be able to use this grounding technique also. Two of my very dear friends here, Ralph and Macy, are doing the anchoring heart technique, and they are doing it 2 different ways, and both are okay. First, you see Ralph, the palm of his hand is held firmly and tenderly over his heart, and he will be taking a nice deep breath. Now, I'd like for you to participate with me, because I do it oftentimes like Macy's doing. I take my non-dominant hand and I put it over my heart as well, and I close my eyes and I take a nice deep breath. Can everybody do that just one moment? Now, I'm going to share with you a chapter in my life. A chapter that has many unmourned losses, lots of guilt, unforgiven guilt, and shame, and diminished self-compassion. And even though there were many traumatic and abusive events in my life, I will tell you that it was an insidious soul injury that led me to dance with suicide. Not once, not twice, but 3 times. So as I tell you my story, I want you to listen for those many losses that I sustained, the unforgiven guilt and the shame that I carried. And it was the shame that led me to feel desperate and alone. As a 7th grader, I vividly remember the day I walked in the door of my home feeling alone, feeling despair and darkness, overcome with feelings of worthlessness. I firmly believed I was a burden in life and had no purpose in this world.
Stephanie, I apologize. I accidentally hit a button and your screen share stopped. Could you share your screen again? I'm so sorry.
That is okay.
Thank you. Perfect. Thank you.
Is that okay there?
Perfect. Thank you so much. I apologize.
Okay. I firmly believed I was a burden in life and had no purpose in this world. My world seemed dark and pointless. And it was not just one reason, I had many. My mother's neglect and drug use, her abusive boyfriends and husband, the molestation that I considered was my fault, bullies at school mocking me and making fun of my family. The list could go on and on. And that day, even though school went well, I was not well, and I wanted out. I felt hopeless that the future could be any different. I didn't want to feel the helplessness and the lack of control that I had in my life. I had tried to use overachieving to numb out my feelings of helplessness, but on this day, I decided to use the strongest numbing agent of all. I decided I wanted to get out. I walked into the bathroom, and I can still smell that room today, and I opened the cabinet. I took out 2 bottles of Benadryl and downed all the pills, and I laid down in my bed and hoped to never wake up. To my utter dismay, I woke up a short time later. Then I did something that many would find odd. I headed to church as if nothing unusual had just happened. The drug started working during choir practice, and I started hallucinating. I was taken to the emergency room where the doctor told my mom that I must have taken some street drugs and to take me home that they would wear off. And 3 days later, when they began to wear off, I told my mom what had happened. She cried, but didn't understand. And more importantly, she didn't change, which made me feel even more helpless because in so many ways, I was at her mercy. The road through high school seemed more positive on most days. Nevertheless, I ran away from home, attended 3 high schools, and lived with my biological dad for over a year, who taught me that the grass isn't always greener on the other side. and he dashed my dreams that he would rescue me with love and protection. But it wasn't until I found myself stuck at a bus station in Dallas after attending my first college visit that it all changed. I was unable to get a hold of my mom to pick me up that day, and a cab driver offered to help me out. Unfortunately for me, it wasn't the kind of help that I wanted. It was a ride, however, I will never forget. When I told my boyfriend what happened, he was shocked, but he also made sure to tell me all of the things that I had done wrong and that I must have caused the rape. And as traumatic as that rape was, his blame had even more devastating impact on me. I had felt overpowered and helpless during that rape, but now he was telling me that I could have prevented it. The helplessness that I felt conflicted with the message that he was sending me, because now I couldn't feel that helplessness. Now, filled with guilt, a guilt that I now realized was irrational, I became more and more depressed. I was overcome with pain and darkness, and to me, the only way out again was death. This time, I made sure to take different pills. However, when I did, I called my boyfriend immediately. I guess it was more of a cry for help. Over the next 15 years, I was in and out of treatment centers. I was inpatient, outpatient, and I had paid a lot of money for counseling sessions. I had put myself through college, and I was on a mission of healing and not letting anything stop me, and nothing did until I met a man who was emotionally abusive. We got engaged, I got pregnant, got married, gained 2 stepsons and a baby, all within 12 months. And every day became unbearable again. How did I get back here? I call it my pit. It was dark and it took my breath away. It would smother me as I struggled every day to get out of it. And who did I tell? No one. Because I just knew my child and my stepsons, my husbands, and the world would be better off without me. My attempts to kill my body had failed, but slowly, insidiously, I had already died inside. My body, my emotions, and my spirit had no life in them. I had become completely separated from my own sense of self. Unmourned loss, unforgiven guilt, and shame were what kept me from accessing my soul. And it was clear to me that I had suffered a significant soul injury. Did you pick up on the many losses, the unforgiven guilt, and the shame, and the diminished self-compassion that I had? I want you to focus now momentarily on losses that an attemptee may have, and using me for an example, because you can hear by listening to my story, which isn't uncommon, is that there are lots of significant losses that we have. What about loss of respect? I had loss of self-respect for myself. I was actually mad at myself because I did not complete the task. How about loss of others' respect? There's a stigma involved. There's a change how others think of you. You are not suffering alone anymore. It is a public affair. What about loss of credibility? You know, people were like, she's just trying to get attention. She can't be trusted. My role would change. I couldn't even be some babysitter because they didn't know what was next. What about loss of relationship? People physically withdrew from me because they don't know what to say. They didn't know what to do. Can you think of other losses? Like maybe the loss of feeling loved, loss of connection, loss of my self-image. Let's look at loss from a loved one's perspective, because their lives are completely changed during that time as well. What about loss of normalcy? Their world is turned upside down. Maybe their hopes and dreams for the future have changed forever and it will never be the same again. Also can have loss of self-respect, but it may look like I'm an inadequate parent, spouse, or a friend, or that wasn't an honorable way to cope, or an honorable death. What about loss of others' respect? The stigma and judgment that's involved, it's the same for the attemptee and the loved ones. And loss of support system. I can tell you there have been many things in my life and people physically withdraw. You can feel it in the air because they don't know what to say and do and how to be there for you. What about loss of relationship with self? Just like that example that we used earlier, that woman said, when she died, I died too. There are many losses that you can attach to either the attemptee or to the loved ones. Accepting those losses instead of resisting them is one of the secrets of gaining your vitality. The reason, however, we resist the loss is because we don't want to feel the pain. Often we don't even recognize the losses there because when we begin to experience it, we disconnect from that part of self carrying that pain. We need to stay open to that part of self that holds our pain. But unfortunately, in our feel-good society, this is not easy and it often seems counterintuitive. But when emotional pain is feared, that part of self that's carrying the pain is exiled away from us. And when we are not willing to listen to that part of ourselves carrying that pain, the pain will be covered up with anger, guilt, bitterness, resentment, jealousy, pain, and many other painful negative emotions. In order to regain our vitality, we must accept those losses. Let's talk about irrational guilt now. We all know the definition of irrational guilt, don't we? The feeling of feeling guilty about action, thoughts, or feelings that are out of our control, and when someone tries to be overly responsible about a situation or a person. So that was pretty easy. However, what I'm going to tell you is that I know that even though we know that definition, many of us do not recognize the effects that irrational guilt has on our own lives. So I'm going to use the example of attempted suicide from a loved one's perspective, because we know that there is a sequence of events that occur. Because when a person attempts suicide, their loved one that day is felt a feeling of utter helplessness. And then they begin to say to themselves, I will never put myself in that position again to feel so vulnerable and helpless. And a decision is made that day to control everything from its reoccurrence. We immediately go to a fear-based relationship to try to prevent these things. We should not be surprised that traumatized people are often overly controlling people because they feel like if they have all their ducks lined up in a row, that this wouldn't happen. If I would just have done this, it would not have happened. Is that true? Irrational guilt gives the illusion that controlling uncontrollable situations, that it won't happen again, but it's just an illusion. So for me, not only have I attempted suicide, but I have had a child that has flirted with it as well. And I know what irrational guilt does, because I began to want to control every minute of every day and everything that person came in contact with. I was on the phone with my husband all the time. And yes, I needed to monitor our child, but I needed to be aware of what was really going on and when I was thinking irrational. The fact was, I thought I was protecting them. but I wasn't. This was an illusion, because the fact was, I just felt utterly helpless. It feels so helpless. So I want to encourage you that when you find yourself taking responsibility for something that you had no control over, I want you to ask yourself, is this rational or irrational? And by the way, if you did not know something, then you had no control over it. If you did not know someone was going to attempt suicide, then you are helpless. You are helpless to protect them. It feels helpless. We need to connect to that instead of shaming it or trying to control it or numbing it out. I'm going to read you an analogy that I hope helps continue to put this whole piece of the puzzle together for you. There is a cup of water sitting on the table. It is so full, it is rounded at the top. 1 or 2 drops of water are added to the cup and it spills over. What caused the water to spill? We want to blame the last 1 or 2 drops, but in an empty cup, these drops would have never caused a spill. It was not the water in the cup prior to the drops being added, because if they were left alone, it would not have spilled either. It was a combination of all of the drops in the cup that came before and the last 1 or 2 drops that caused the cup to spill over. In a person's life, the water in the cup is symbolic of hurt, pain, shame, humiliation, and loss not dealt with all along the way. The last couple of drops symbolize a trigger event, the last straw, the event or situation that preceded the final act of someone taking their own life. And often we want to blame that trigger event, but this does not make sense to most of us. Like the water, these events all by themselves would not cause someone to end their life. It is the combination of everything in that person's life left unresolved all along the way, with the last 1 or 2 things that caused our loved one to lose hope. And for us, we must find a way to pour out that water along the way as we grieve this pain and feel the helplessness. We must learn to deal with our pain before they become acts of desperation. With suicide, successful suicide or unsuccessful suicide, it is almost always fueled by desperation, which is fueled by shame. What about after suicide attempt? There's more shame because we are afraid of who we are and who we are not. Let's talk about shame and guilt. We often use these terms interchangeable, but I want to tell you right now, they are very different and we should be very distinctive of how we use them. Guilt tells us what we did was wrong. Shame tells us we are wrong. Guilt provides feedback for learning and growth. Shame beats us up, is self-punishing. Guilt guides us towards increased compassion for self and others. Shame robs us of self-compassion and fills us with feelings of worthlessness. Guilt mobilizes us into new behaviors. Shame keeps us stuck and immobilized. Shame is one of the primary causes of a soul injury because it tells us that something is wrong with us. Shame disconnects us from our true self. That is a soul injury in the making. Where does emotional pain go? Research tells us that though we pretend that we don't hold on to emotional pain, that we hold on to it in our bodies, our minds, and our deepest part of selves. Dr. Bessel van der Kolk has written many books about trauma and the brain. And in this particular book, The Body Keeps the Score, he describes many studies that recognize that when we don't deal with trauma, pain, and emotional distress, that it gets trapped in our bodies. We see it all the time, don't we? Our back pain, our head pain, our aches, and our depression. The physical signs are out there. What we end up doing most of the time is how we stuff that emotional pain down or store it away, is we use our numbing agents to cover them up. And on the screen, there is a multiple list of numbing agents, but you and I know that there are so many more. And to be honest, on any given day, I might find myself using many of these. Sometimes I'll say, oh, I'm being professional, mature, oh, I'm fine. What we need to realize is what is our numbing agent, and we need to be aware of the way it is preventing us from healing our pain. I'm going to share with you a recent example. I recently had some loved ones that I was hurt by, and I felt betrayed by. I felt disconnected and unloved with. And guess what I did? I didn't go to one numbing agent. I went to 2 numbing agents. Oh yeah, I went to the 3rd numbing agent. Why am I telling you this? Is because it only took me one day to recognize that I was trying to cover up my pain and my hurt. And when I recognized that I was numbing out that pain, I began to grieve the losses that I felt in that situation. I began to heal the pain that had occurred inside of me. I began to forgive, even though I wasn't asked to. And I also had to forgive myself for going to my numbing agent so quickly. And then what happened was I released that emotional pain because I knew I did not want to sustain another soul injury. What you will find is that it is easy to camouflage our pain. Camouflage is important sometimes, but we have to know when to take the camouflage off and sit with our pain and in trusted environments so it doesn't become a problem. We have to learn to grieve losses. Many of us in hospice know this quote, "Those who grieve well, heal well." Why is that true? So grief isn't stored. Grief is a natural, normal expression of loss, disappointment, and failure. Grieving releases emotional pain. Grieving is creative. It helps us let go of what was and open up to what is. Grieving can create space for our new reality, the now, and helps us regain our vitality. The purpose of grieving is so that you don't get stuck. You don't get stuck in that pain, despair, and darkness. So grief, it is not destructive in the way it's commonly perceived in our world. It is unmourned grief that is destructive. I'm going to read you a letter that was written to grief because it expresses the many different levels that grief has. Dear grief, how many times have you come with your black shroud wrapping your darkness around me? As life went along, you came to me with each loss, but I was quick to fold your black shroud and hide you away, thinking I was protecting others. Then I lost my dear husband. You descended upon me, but I did not resist you this time. As my tears flowed nonstop from my eyes and my spirit, it was though you were inviting me on a journey, and I allowed you to take control. And like a little train, our journey began. The first stop was guilt. Could I have done more? Did I do enough? Did I give enough? I wish I'd held my tongue more. Could I have shown more understanding? This was a hard stop, but I let myself stay here long enough to examine my doubts. And by doing that, I came to the satisfaction that could have done no more than I could have at the time with the strength that I had had. The next stop the little train made was anger. Why was I so angry? Why wouldn't people stop acting as if I had not experienced a great loss? Why was I being urged to get on with my life? Couldn't they see I was locked into a place that had not been my choosing? As I lingered at this stop, I came to realize that forgiveness made it possible for me to get back on that little train and continue. The next stop was loneliness. It was difficult to see how I might get past this stop. It felt like I had been thrown off a mountain and was left trying to crawl back up in total darkness, having only jagged edges to hold on to. But I let myself feel all of those deep emotions of loneliness. And with time, I decided to get back on that little train. The next stop surprised me. It was pleasantness. I started feeling the sun and its warmth. I saw blue sky and noticed the colors of flowers and birds and leaves because they had been lost to me during my journey of grief. I reflected back on the other stops and realized that having let myself get off at each stop, I no longer felt lost. But there was another stop. This stop was the stop of new life, a new way to live in the world without my love in it. I really hadn't thought it possible. And if anyone would have told me that I could not be so vitally alive, I could now be so vitally alive without him, I never would have believed them. But my journey of grief had yielded many lessons. Lessons like, don't take life or people for granted. Give love freely and unconditionally. Decide to forgive. Take steps to heal anger. And live each day so that it has worth and meaning. So grief, I no longer fear you. I no longer feel I should hide you. You are my friend who leads me through my pain so that I can make the necessary and healing stops along the way to the place where new life begins. We already have everything that we need in order to be whole. It's barriers that keep us from accessing that wholeness. We have to remove those barriers. We need to learn how to develop a relationship, a different relationship with that part of ourself that carries that emotional pain. Because the fact is, when that pain shows up, that difficult part of self, we don't say, hey, I'm happy to see you. Why don't you sit down here? No, just like I did. I'd go away. I don't like you and I am afraid of you. What we need to be saying is, tell me how you're hurting because I will listen. Because isn't that what we authentically want from others? We have to be authentically able to do that with ourselves. How would the world be different if we were not afraid of emotional pain? We would have more of a connection with ourselves and a deeper connection with the world around us, instead of using our numbing agents, our anger, our despair, and our depression. I just wanted to touch on forgiveness for just a moment. Forgiveness is honestly about a 2 to 3 hour conversation, but I think it's very important to address today because forgiveness, it is not a simple process. It's not like this girl here, hey, I'm sorry, as she puts her hands up. No, it is more than just words. When you want to authentically forgive, you have to be able to acknowledge wrongdoing, rectify the situation, reassure that it won't happen again, and then you must wait. You must wait till the one that you've wronged is willing to forgive you. It is not a light switch moment, but it is very important to consider the process. Peace and pain can sit side by side without fear. We just have to create a space for that emotional pain. It just means getting better acquainted with who we are and that part of self that likes to store the pain away. It means learning how to grieve and grieve well. And it means suspending our numbing agents. We have to learn to speak a different language. We need to access our soul so we can use it to help heal. Let's get rid of the elephant that's sitting in the middle of the room so we can learn to speak the language to each other. Professionally, with our patients and our colleagues, and publicly, so we can help heal the soul injuries in our midst. So a quick summary is steps to healing is be curious. Be curious how your mind operates and how other minds operate. Don't be judgmental. Stop being afraid of guilt. Guilt's a good thing. Guilt's a good thing. And if you did something wrong and you had no control over it, seek forgiveness, including your own. And if you were helpless over something and you had no control over it, stop covering up helplessness with irrational guilt. Let yourself feel the helplessness. Learn how to forgive authentically. Experiment with tools. Draw your pain, dance with your pain, sing to your pain, cry your pain, write a letter to your pain, and let your pain write a letter back to you. Integrative letter writing is known to be a great tool to help those deep wounds heal, better than journaling. When you are living your life passionately and with purpose, I believe you will stop being afraid of your pain. You will tell your ego to stop covering up your pain with anger, fear, shame, and you'll stop those numbing agents. You'll talk to that part of yourself that carries that pain, and you will comfort yourself, not with those numbing agents. And it's very important that you tell a trusted one about your pain. And if you're in the middle of distress and crisis, reach out. Here's the suicide prevention line phone number and texting. There's someone there 24/7, and they quickly answer and are authentically there to support. It does not have to be with suicidal ideations. It can be simply in distress and a crisis. So now, I hope that I've been able to answer all those questions for you today. And my hope is that you can see that I'm not just talking the talk, that I am walking the walk, because I want to be my true self. I want to authentically be who I was meant to be. And my hope again is that you are able now to recognize soul injuries and help heal soul injuries in your midst. This is my contact information. I have my email and phone number. I am happy to entertain any questions, thoughts, or curiosities that you may have. Those are many soul injury presentations that I give. Opus Peace has Leaderships Institute. You can come on the bandwagon with me. We have one next week. I'm not sure if you can get in with that, but you can always call and see. But we definitely have one in April. And we also have several films available: Soul Injury, Unmourned Loss, and soon to come out, Forgiveness. Thank you very much for your time. It has been an honor.